Maggie Gunhus. Brittany Maynard, a 29-year-old living with an incurable brain cancer. She only has 6 months left to live. Her family and friends would have to watch her suffer each and every one of those days. So Brittany decides to move to Oregon, where assisted death is legalized. She then dies October 21st of 2014, but with dignity instead of pain, because of physician-assisted suicide. That was according to an article Brittany Maynard, as promised, ends her life at age 29, found in the Washington Post on November 2nd of 2014, written by Lindsay Bever, who is a master in journalism. We have all been in the position where someone you love is suffering, and there is no cure to that pain. The Minnesota Department of Health should legalize physician-assisted suicide. I will first tell you the problems that patients have by not having assisted death. I will then tell you the solution to these problems. Now, I will first tell you the problems patients face by not having assisted suicide. There are many problems, but the first problem many patients face are the medical expenses and decisions. In 2010, Medicare paid about $55 million just for doctor and hospital bills for the last 2 months of patients' lives. From the article, the cost of keeping the terminally ill alive in July of 2011 states that approximately 20 to 30% of these bills had no meaningful impact. These bills are being paid for, no questions asked. According to Fred Mogul, from the article Terminally Ill but Constantly Hospitalized in September of 2014, it states that in Mount Sinai, the staff is required to discuss hospice alternatives with any patient that is terminally ill, because a person shouldn't have to spend the last months of their lives living in the intensive care unit. That is unnecessary suffering, as well as an insane amount of money being pushed onto taxpayers. From the article, Termination of Life-Sustaining Treatments, written by Clarence Braddock from the University of Washington School of Medicine, written in April of 2006, he states that patients who are receiving treatments that are keeping them alive sometimes have to make decisions whether or not they want to continue those treatments. For some people, these treatments become no longer beneficial to them. When they are no longer beneficial, they are then just living in pain, and that is unnecessary, but their death can take up to weeks. Patients also sometimes, or the family even, just no longer want the person to undergo these treatments. A patient still has to be treated humanely, but they can reduce their food and fluid intake up to an extent, so they are just slowly killing themselves. Other problems that patients face are mental illnesses. In February of 2000, Jane Turner and Kelly Bryan wrote an article, Emotional Dimensions of Chronic Disease, published in the Western Journal of Medicine, that states, people, when diagnosed, can react in one of 5 ways: anger, depression, anxiety, denial, or determination. Of course, everyone experiences a bit of fear. These fears can include dying alone or not getting to say goodbye to their loved ones. Other fears are the loss of their independence or not fulfilling their dreams or their wishes. And it may be hard to diagnose, but most people with a terminal illness have chronic depression. But even a mild depression may decrease a patient's ability to want to go and seek help. This hopelessness can undermine the patient's ability to cope with their pain. In October of 2015, the ADAA wrote an article, Serious Chronic or Terminal Illness, that states 40% of cancer patients after diagnosis reported developing significant stress that can lead to things as of high stress levels, anxiety, or PTSD. And caretakers for people with a terminal illness are also at a high risk for developing anxiety or depression. Now that you know the problems, I can tell you the solution. The solution to these problems is to legalize physician-assisted suicide. According to the article, Physician-Assisted Suicide, Fast Facts, by CNN in June of 2016, states that 5 of the U.S. states have already come to the conclusion that this is the best option. Those states are Oregon, Vermont, Washington, California, and Montana. Of course, these states have to apply by some rules. These rules are, a patient must have a terminal illness, they must have a prognosis that they have 6 or less months left to live, and of course the physician must be willing to participate in this act. By allowing this, medical bills for these patients will go down. They will no longer have to endure surgeries that they do not want or be paying for life support. Taxes will also go down for other people that are paying for them once they die. The money then can be spent for the happiness of this patient so they can enjoy the last months of their lives. They can put this money to fulfill their dreams or do things and cross them off their bucket list. They could also put this money towards their family needs or even their own funeral needs. And also, fears of dying for the people with a terminal illness can somewhat cease because they will be able to choose the day they would like to die. They will be able to say goodbye to their loved ones or maybe even have them there with them. They will get to choose where they are dying, whether that's in the comfort of their home or somewhere else. And they will also be able to die with dignity. As you can see, legalizing physician-assisted suicide solves many problems. Now that you know the problems that are caused to these patients, the Minnesota Department of Health should legalize physician-assisted suicide. If a person has the right to refuse life-saving treatments, shouldn't they also be allowed the freedom to choose to end their own life, just as Brittany Maynard did?
5